Okay, as promised, here we are. Here's the second half of the Chapter 10 lecture, the skeletal system. Here's a brief overview. You see here we're listing some of the bones, and those of you moving on to anatomy will be learning all these bones and a whole lot more. We're going to talk about them tonight. We're not going to have you learn all of them, but I'm going to take you through the skeletal system and teach you the main bones and the main sort of features of the skeletal system. So we're getting that in just a moment. My slide is frozen. Give me a second. Here we go. Human skeletal system consists of 206 bones. After next week's lecture, I will give you a very strong argument that you are actually 212 bones in the body. But there's a caveat to that. And there truly are 212 bones in the body, but we're dealing with 206 of them this evening. There are two different aspects to the skeleton. There's the axial and the appendicular skeleton. So the axial skeleton here is depicted in this bluish sort of color. This protects internal organs, central support of the body around which other parts move. It's the head, chest, and spine. And then we have the appendicular skeleton, and that's illustrated in this sort of bluish pink color that's around the outside. These are what we call the extremities. So the appendicular skeleton enables the body to move, shoulders, arms, hips, legs, that sort of thing. So once again, that axial skeleton, if you think about this and look at it, you can subtract the appendicular skeleton, and as long as you had someone who could provide you with food and be able to move you around for the various things you would need to do, you can survive. Everything you need for survival is in the axial skeleton. You'll also notice that we will refer to the spine, the skull, and a lot of the rib cage. That's some of the heavier bones we have in our body, and it's designed to really protect our internal vital organs that keep us alive. Versus the appendicular skeleton, and once again, the arms and legs. Very inconvenient to have to live without these appendages, but life is possible, not easy, but possible without that structure. Without the axial skeleton protecting the internal organs, life is very much challenged. So there's a big difference there. And once again, I just want to remind you, in orthopedics and other aspects of medicine, when we talk about the extremities, we're referring to the appendicular skeleton. So that's the arms and the legs and the pelvis bones as well. Arms and shoulders are called upper extremities. The lower extremities are the pelvis and the legs going down. So that's an important term, especially if you're going to work around orthopedics, to know that what an upper and a lower extremity consists of. We have four main types of bones. I'm not going to test you on these, so we'll just go over them quickly. And just so you have an idea, when you get to anatomy, you will learn these in greater detail. Long bones are the strongest bones, arms and legs. So think of the humerus, think of the femur, radius, ulna, tibia, fibula, those types of bones. Shorter bones are cube-shaped bones, ankles, wrists, and toes, where you'll find those. Flat bones are more broad bones, so the skull, shoulder, ribs, think of the shoulder blades themselves, large, flat bones. And then we have sort of oddballs, they're known as irregular bones. These are varied in shape and sizes. They're commonly clustered together, as in vertebrae, some of the bones of the face and the ears. We also have two types of bone tissue. We're not going to go into this in great detail. Know that there's spongy bone. That's the inner portion of the bone. It's porous, vascular, which means it has a blood supply. It makes bones lighter. You know, if our bones are solid calcium, we'd all weigh 600 pounds. So they're hollowed out, and they have the spongy bone on the inside that gives it support. They provide space for bone marrow where blood cells are produced. So you may or may not have known that. But blood marrow is where your blood cells, bone marrow is where your blood cells are produced. So it's vital to the circulatory system and for the cardiovascular system in general that there's a blood supply, and that's coming from the inside of the bones. Then we have compact bones. So that's more the outside. That provides protection. It gives durable strength to bone, and it serves as a place of attachment for muscles. So those are two types of bone tissue. Once again, you're not going to be tested on them. And just so you know, we also have different aspects of bones. So in a long bone, we have the periosteum. That's the structure around the bone. We have the diaphysis, this is the shaft of the long bone. Epiphysis is the end of a long bone. And the medullary cavity is the marrow cavity and the shaft of the long bone. Once again, you're not being tested, but there's a little bit of warm-up for you. So when you get to anatomy, you'll have at least heard those words before. And if you want to do a little in-depth sort of study, you can use your own time to kind of look those words up and see what the areas of the bone do what. So the periosteum has a function. diaphysis, epiphysis, medullary cavity, they all have their own functions. Here is a word, though, you are going to be tested on, so definitely catch this one. Articulation is a place where two bones meet. So we often call it a joint. And orthopedists, primarily when it comes to joints, they deal with three, really. They deal with shoulders, hips, and knees. And here we have on the left a depiction of a hip joint. You see the acetabulum. That's that sort of round thing that the head of the femur sits in and causes that pivot movement. And then we have a shoulder here, which is a little bit different. There's not nearly as much structure around the humeral head to kind of keep it in place, which is why shoulder dislocation is something that happens quite frequently. So these are articulations. Another word is a joint. And we have several of them. Those are not the only ones. PT, I think we just covered this in the last slides. So physical therapy, we're going to try to treat that orthopedic pathology you have without using surgery or drugs first. So that's our initial treatment. Surgery may be the place we end up going. Now, there are various types of specialties when we talk about bones. So when we get to chiropractors, these are healthcare providers. They're not doctors, and they treat musculoskeletal disorders without drugs or surgery. They practice chiropractic medicine, and this is basically based on the concept that disease is caused by pressure on nerves, and if you can adjust the bones around and relieve the pressure, you can also fix the pathology. There is and isn't truth to that depending on who the chiropractor is. Now, having said that, some chiropractors actually are doctors, and some are not. And the practice of chiropractic medicine can be a bit, how do I say this, a bit dodgy at times, I guess would be the word. But in my life experience and seeing people go to chiropractors and seeing various different results is really do your research before you go. And honestly, if you have a problem you think you might need to see a chiropractor, go to your primary care, talk to them, and they can refer you out to really reliable chiropractors most times because they'll know them. There are some people who practice chiropractic medicine who don't really know the medicine that well and sometimes make injuries worse, and it's hard to differentiate that if you're just going to Google a name and look them up. I would always go from a medical reference. Typically, one MD will refer you to another MD who is also a chiropractor, and those are usually very safe bets. Okay, I'm going to give you some combining forms. There'll be a lot of slides in this particular lecture that it's going to show us one word and we move on. So they'll be going by kind of quickly. I'll kind of tell you what you need to know, and I'll throw in a few fun facts as we go. When we talk about the spine, the combining form is spino. And if we put AL on the end of it for pertaining to, we end up with spinal pertaining to the spine, which you see depicted here. Lumbo we had in the last one as well. I know we had a precursor to this lecture with a few of those slides. And so lumbo meaning lower back or loin. Now here's a couple of different words though. We had the combining form in the previous chapter, but we didn't have these words. We had lumbar when we talked about muscles. But there's also lumbodynia and lumbago. So lumbago always makes me laugh because it's a very, very old term. It's rarely ever heard before. But if you have an older physician who maybe got their medical license back in the 50s or 60s, they may still use the term lumbago. Lumbodynia also isn't used that much. Most times they just call it lower back pain. But these words are out there, so be aware of it. And it's good to know in case you ever run across it in an op report or an x-ray report that they have a history of lumbodynia or lumbago. You'll know what they're talking about. Now we have basically another articulation here, and that's the lumbosacral region. So lumbo meaning lower back or loin, and the sacrum is the very posterior aspect of the pelvic girdle. So all the way around at your very lower back, there's this hard plate right at the base of the spine. And that's called the sacrum. And the sacrum is considered its own vertebrae. In fact, it's 5 fused vertebrae. They at one time were mobile. They no longer work in terms of movement, but they ought to provide your body with a lot of support. Your entire spine is supported by the sacrum. There's a joint at L5, which means the 5th lumbar vertebrae, the very base of your spine, and S1, which is the very top of the sacrum. And there you have something called the sacral prominence. And L5, which is the bottom of the spine, sits right on it. And that is referred to as the lumbosacral region. This is pertaining to the lumbar and sacral spine or region. This is the hot spot for lower back pain. I'd say just in my general experience in medicine, and especially now working in orthopedics as a rad tech, I would say probably 60% of lower back pain has to do with lumbosacral, L5-S1, and if you work in that practice, you'll hear that term used a lot. Okay, so we do have some abnormal curvatures that happen with spines. We x-ray them a lot, and so we're going to talk about them here. We have something called kyphosis, we have lordosis, we have scoliosis. I've seen all three, and almost every shift I x-ray all three in some form or the other. So we'll start with kyphosis. This is increased curvature of the thoracic spine. In other words, the mid-back, the part that attaches, that your ribs attach to in the posterior part of your body. And when there's an increased curvature of the thoracic spine, it could be called hunchback, which is kind of not an appropriate term. We prefer to call it kyphosis. This is caused by poor posture, arthritis, or osteomalacia. So you can induce kyphosis by simply having bad posture for years and years. If you were to sit with your shoulders hunched forward or walk with your shoulders hunched forward and a slight curve in your thoracic spine, eventually the spine will take on that shape. So it is something that is preventable. Usually physical therapy, strengthening of the back muscles can help a lot. And it takes a conscious effort by the patient to actually keep that spine straight and not hunch forward. We have a lot more kyphosis in modern man than we've seen in a long time due to our use of technology. If you think about your cell phone, when you're looking down all the time, you're bowing your thoracic spine. You're inducing kyphosis, acute kyphosis, because you can straighten back up. But over years, your spine might bend into that shape. Also sitting in a chair and being on a computer or sitting and watching television, the shoulders tend to come forward and it tends to create this hump-like structure. So kyphosis is something you can induce, something you can prevent. And I suggest, using good posture to try to prevent it, because once it sets in, it's really hard to correct. Lordosis is the opposite. This is a forward curvature of the lumbar spine. Now, all lumbar spines have a forward curvature. It's normal. But when it's excessive, that's when we talk about lordosis. So forward curvature lumbar spine that leads to a splay back posture. It's caused by increased weight in the abdomen, such as during pregnancy. So for any of you ladies, if you've ever been pregnant, the way that pulls on your lower back and causes the lower back to bend forward, and it can be very painful, that's exactly lordosis. With pregnancy, usually it corrects after the pregnancy is over, but not always. And other things can happen. Excessive weight gain or just poor posture, once again, can cause that sway back. So in this situation, the shoulders aren't hunched forward. In fact, the person's actually leaning backwards, and sometimes when you see them walk, it looks like they're about to fall down. I often think of, if we were to think of medieval Europe and the Lord walking into the manor, they always had the head tilted back because they looked down their nose at people, which is where that expression comes from. Lordosis, that's how I associate that, the Lord walking into the manor. And scoliosis, this is a sideway curvature of the spine, left, right, in many cases, both. I've seen spines that look like an S, and you're talking to the person, you're setting them up, and you can't see that necessarily. You can see maybe the body's a little off balance. Then you take the x-ray and see how much curvature they actually have, and wow, it's really startling sometimes. The sclerotic spine they're showing here, it is very, very slight scoliosis here. If you really want to see extreme scoliosis, you can go online and look up scoliosis x-rays, and you will see some things that will just blow your mind. And people are walking, talking, moving around. They look perfectly normal. You wouldn't suspect it. Sometimes you see it. Sometimes the shoulders are off balance, or the hips are out, or one leg's longer than the other. So sometimes it's visible, but oftentimes it's not. Then you take the x-ray and look at the x-ray and think, my Lord, how do they move around? Also keep in mind that while we refer to scoliosis as curvature to the left or right, it often involves a twisting of the spine as well. So not only is it leaning left or right, but it's also turning in a way that's abnormal. For some folks, scoliosis is a lifelong, chronic, extremely painful adventure. The one way they fix it is they implant surgical rods surgically along the spine and literally tie it to it and force it to go straight. And I'm oversimplifying the procedure. And if you ever see an x-ray of of someone who's had that surgery, you see basically two long steel poles going down on either side of the spine, and they're holding it straight. Not everyone gets that surgery. Not everyone qualifies for it, but some do. All right. We're going to stop there, and when I come back, we're going to start giving you the layman's terms for bones, and then we're going to start talking about combining forms for bones. I'll be right back.